Hello, my name is Maureen Padilla, Senior Vice President for Nursing Affairs and Clinical Support Services. I hope you've already heard about the new quality check process. This is the new performance review process for the upcoming evaluation period. The organization has supported nursing by creating a custom template to meet nursing's needs. I hope you've taken the time to attend either a virtual training session or the presentation recording in SABA. This training is specific to nursing services staff members. This video recording is another training source for you. You'll learn how to perform the general check-in process from both the employee and the manager standpoint. This video example shows a nurse clinician and a nurse manager, but the check-in process applies to any person, no matter what the job role or the department. So thank you for all you do every day here at Harris Health System, and thank you for your attention to this important process.
Let's start with the basics. Quality Check and the One Harris Health Competency Framework seek to connect Harris Health employees through the 3 domains vital in each of our job roles. In nursing, we ensure we embody these domains in all our interactions with patients and each other. This is critical to our system's culture and transformation to a high-reliability organization. At Harris Health System, the employee feedback process, now called Quality Check, will be open year-round to allow for more frequent feedback throughout the year. A meeting that occurs before the end of the cycle is called a check-in. This year, nursing services supervisors are encouraged to have one check-in with each of their employees. In this video example, you'll learn a general structure and process to follow and some best practices for conducting a check-in within the clinical setting.
Hi Cheryl, I'm here for my check-in.
Good to see you. Come on in and have a seat. How's your shift going?
It's going well. I've completed all my initial assessments. My patients are stable and Pam's going to cover me while I'm here.
Okay, great. I'm glad that our charge nurses can cover during these scheduled check-in sessions. And so since this is new for all of us, let's get started. I'd like to start by recognizing the excellent care that you gave Ms. Hernandez last week. I received feedback from your CRN that you noticed some of the initial subtle changes of sepsis and you developed an excellent individualized care plan. You're doing a great job for just completing orientation.
Thank you. My preceptor did a great job covering the sepsis protocol. By the way, thanks for the e-card you sent me last week. I really appreciate that.
Of course, it is my pleasure to celebrate our staff's birthdays and achievements. All right, Kevin, I want to thank you for entering your goals into PeoplesOff. I reviewed your goals and I saw that one of your goals related to the nursing job standard of professional role and responsibility. You would like to obtain your specialty certification. How's that going?
It's going okay, I guess. I bought a core curriculum book, but haven't really had a chance to study yet.
Well, you've only been working in the specialty unit for about 1.5 years. Usually it takes about 2 years before you sit for that exam. But you're doing the right thing by studying ahead of time and getting prepared. I would suggest you connect with Alicia, who recently passed the exam, and see how she did on it and how she prepared herself.
Oh, it sounds like a great idea. I will.
Wonderful. As you know, your goals support our new system values and behaviors described in the One Harris Health Competency Framework. I see you listed your goal to achieve your certification under ensuring quality and patient safety. I would suggest that you would consider, Kevin, listing that goal under embracing learning and adaptability. In terms of the competency framework, could you please share with me how else you would be demonstrating these values?
Of course. I've been reading about the learning and adaptability competency, and I was really inspired by my preceptor, Sue. I think I want to take the preceptor class and maybe precept in the future.
I think you would be a great preceptor. I notice you have a knack, especially for teaching wound care, and you just get those nursing students in and explain that process to them, Kevin, so thoroughly. What's been one of your biggest challenges since coming to work here for us at Harris Health?
I noticed there's been a lot of changes lately, and the changes are good, but sometimes it's a little hard to keep up.
I understand. How can I help?
I really like how you keep us updated with what's coming up at the system level during shift change and during the huddles. I've been trying to read my emails, but sometimes it's hard to keep up on those emails.
Thank you, thank you, thank you for trying to reach your emails every shift. There's a lot of information shared via email, and it's important that we keep up with the necessary information to embrace change. So how are things going with you and the other staff members?
Oh, great. Everyone's been so supportive, and there's a lot of teamwork on my shift. I got a chance to sit in on the COP the other day. I really enjoyed that.
Excellent. I think that we have a wonderful team as well. Our COP has been very active working to improve our unit quality metrics. Kevin, may I share some feedback with you on an area where I think that there can be some improvement?
Oh, yes, please do.
I reviewed your documentation on Mrs. Smith the other day, and you've been timely in completing your documentation. I think that is wonderful, but the care plan was not specific and individualized for Mrs. Smith. There was a plan of care for her primary diagnosis, but I did not see any information for education on her new diagnosis of diabetes and discharge planning.
I didn't think about that. I agree I could do a better job individualizing the care plan. I guess I could have reviewed the Nursing Reference Center for more insight on her clinical situation. Is there a good resource that you would recommend?
Absolutely. I think the Nursing Reference Center is an excellent evidence-based resource for you. I also would like to suggest our Policy 468, Interdisciplinary Plan of Care. That could be a resource for you as well. Do you think you can develop a goal on improving documentation for care planning by the time we do our next check-in?
Absolutely.
Awesome. Your openness to feedback and your willingness to try new things are two great strengths, Kevin. There is a One Harris Health competency related to communicating effectively under the interpersonal domain, and proper documentation supports that competency. Your two goals will be to work towards your certification and to improve your care plan documentation.
Yes, I'll draft a new goal and send you a note in PeopleSoft today. Effective documentation is definitely something I can work on. Thank you for the support and thank you for the feedback.
I appreciate what you're doing for our organization, and thank you for the wonderful, excellent care that you're providing for our patients. Once you obtain your certification, we'll sit back down and talk about you maybe making plans to start our nursing clinical advancement program.
That'd be great. Thank you.
This check-in was productive and effective. Factors that contribute to a positive check-in include employee and manager preparation, open communication between the employee and manager, constructive and specific feedback, and recognition was offered. Because the check-in was planned, both the manager and employee had time to organize and prepare questions. The manager started the conversation by recognizing the employee's achievements before delving into a dialogue that offered constructive feedback to both the employee and the manager and provided the employee with an opportunity to discuss his or her career goals and craft new ones. For nurse clinician staff, appropriate goals would relate to personal or professional practice. Please visit the Harris Health intranet and go to the Performance Management tile on the Human Resources page for more information, or reach out with questions to the Learning and Talent Management team.